Welcome back to NBC LX. Today is, yes, the first day of October, and it's also Breast Cancer Awareness Month. So we wanted to run through some quick facts in a segment that we call Two Truths and a Lie.
Yeah, and you've actually probably played this with your friends in college or at some other point in your life, but basically we tell you three statements and break down which two are truths and which one is a lie. And first, this one, pretty easy to get off the bat, but men don't get breast cancer. It only affects women. That is a lie. Each year is estimated that approximately 2,190 men will be diagnosed with breast cancer, and more than 400 will die from the disease. Men should check themselves periodically by doing self-exams, and doctors say you can detect something is up if you feel a hard lump in your chest area.
Yeah, men also have a higher mortality rate than women because they are less aware about the effects and the symptoms of breast cancer. All right, next one, smoking causes breast cancer. And yep, we hear it all the time, and yes, this is in fact true. A study published in Breast Cancer Research confirms smoking is associated with a significant increased risk of breast cancers, especially in women who started smoking during their adolescent days or who have a family history of the disease. Of course, smoking is a confirmed risk for many other types of cancer as well.
And the last one, you could probably guess because we've already told you the lies. This one's a truth. Taking oral contraceptives increases the risk of breast cancer. It's very true. In fact, it happens for women who've been using birth control for more than 5 years. They're at a greater risk, and so are for women who are 45 years and older. It also is important to note that breast cancer is treatable, and it doesn't always mean a death sentence, but it can be tough to hear from doctors that you have breast cancer. Plus lymphedema, which is a painful condition that actually affects 1 in 3 breast cancer survivors. Now, to talk about what lymphedema is, we're actually bringing in breast cancer and lymphedema survivor Dr. Sheri and Rick Carreon, who are developing a better way to detect lymphedema. And first, thank you so much for both taking the time to be here. Can you better describe for our audience what lymphedema is?
Well, lymphedema is a buildup. It's characterized by a buildup of lymphatic fluid, and it causes painful and sometimes debilitating swelling of the affected limb. Now, it develops in stages 0 to 3. And if it's caught early in stages 0 and 1, it's reversible, treated with simple at-home care. But unfortunately, most patients don't experience symptoms until swelling has developed. And it can be too late for prevention at that time because once stage 2 sets in, it becomes a chronic condition that someone will have to manage for the rest of his or her life.
Wow. And can you give us more details on what exactly you're developing at the moment? This one's for you.
Tossing that to Rick.
Yeah, thank you. We're developing a technology and a device that's been approved by the FDA, and by the way, is in several hundred cancer centers today, that detects the early onset of lymphedema. As Dr. Sheri said, at stage 0 or early stage 1, if caught at that time, it is reversible. So our device detects small fluid shifts in lymphatic systems in the arm, and then if treated with a simple compression sleeve, it can be reversed. In fact, this clinical studies would show that there's a 95% reduction in the progression of lymphedema if caught early enough. And that's what our technology does.
Thank you, Rick. And what about early signs of breast cancer and lymphedema?
Well, hey, early signs of breast cancer, you need to know your body. I tell individuals, some people still refer to it as a self-breast exam. I found the lump in my right breast actually 12 years ago to this day.
Wow.
This is a very emotional day for me, but I'm super excited that I get to share with other individuals what they can do to reduce their risk of not only breast cancer, but completely almost have the opportunity to eliminate finally beating breast cancer like myself, and yet now not having to deal with this debilitating disease of lymphedema. So know your body, know the signs, know when something is not right. Make sure you get in for your screening as recommended based upon your age. Know your family history, and make sure you're getting out there and living a healthy lifestyle that would promote healthy limbs, promote healthy tissues, and promote a healthy mental capacity in order that you will stay on top of your physical health. But I'm telling you what ImpediMed is doing. If I would have had the opportunity years ago, I was a practicing physician, wanted to be a doctor ever since I was 2 years old. And after 16 years of practicing, after beating and battling breast cancer, I was forced to live with this chronic condition, which stripped away my ability to do my clinical practice. And I had to completely reinvent myself. So to have the opportunity to allow other individuals not to have to live through my plight is a wonderful, wonderful way to celebrate my 12-year anniversary of finding the mass in my breast.
And we are celebrating with you today, Dr. Sheri. And I am curious for both of you, what is the one thing that you want our audience to take away from this conversation before we let you go?
I would say, from my okay,
go ahead. Rick.
Rick, we'll let you start. Dr. Sheri, we'll let you end.
My takeaway is this. You have the opportunity. If you're diagnosed with cancer, you have the opportunity. Reach out to your health system, reach out to your physician, ask about the opportunity to understand more about lymphedema, and ask, is there a way that I can prevent this from happening? Because ImpediMed has created an opportunity to do that. And I want individuals to be able to be out there and live today and every day and know that one disease, breast cancer or any cancer, does not have to cause another chronic disease, lymphedema, if you have the proper tools to diagnose it early.
And Rick?
I think what's important here also is that the vision that Dr. Sheri has in her foundation. I mean, for her, it's about the education, right? It's about growing awareness to make sure that people understand that there all are alternatives. And I think more importantly is the underserved population in which her foundation is going after. There are thousands of breast cancer patients every year who are pushed to the brink of financial hardship because of their treatment. And they can't afford a simple compression sleeve. So we believe her vision, with the resources we bring in together, we believe we can eliminate breast cancer-related lymphedema in our lifetime. And we feel that that is a vision worthy of achievement. So we're so proud to be aligned with her organization and with her.
Absolutely. And I thank you both for taking the time to be here and to educate us all on lymphedema. This is something that I previously didn't know about as well. So definitely appreciate you both.
Thank you.